Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about low-dose immunotherapy. I've been posting about LDI a little bit lately, and there's been some questions coming up from those videos. So one of the questions was around whether SIBO, or rather, can LDI help if SIBO, which is small intestine bacterial overgrowth, has led to issues like mast cell activation syndrome, which is basically a whole whack of extra histamine being released in the body from certain triggers, multiple chemical sensitivities, salicylate sensitivity, and then the question was about, said, etc. So it sounds like someone is suffering from a lot of different sensitivities, and I'm sorry to hear about that. And it's really rough, and it's unfortunately sometimes people get a whole whack of sensitivities, either from triggers like SIBO or maybe other things. So the issue with SIBO, one of the many issues with SIBO, is that sometimes what can be a trigger for mast cell activation syndrome itself. And the question mark that I would have is, well, is the SIBO completely rectified? And that's sometimes a hard question to answer, because unless all the symptoms are gone and a person's been thoroughly treated with biofilms and there's a follow-up SIBO test, a lactulose breath test as it's called, all looking totally normal, then there may still be some residual SIBO. So it might be that there's still SIBO that's driving some of those issues. And if that's the case, then low-dose immunotherapy might be helpful. Thorough treatment of that SIBO would also be probably an important thing to do. But let's just say, for the sake of argument, that the SIBO has been fully addressed, and they're including eradicated from any biofilms that might have been kicking around, and if a person's still left with those issues, can low-dose immunotherapy be helpful? Of course, this doesn't constitute any direct medical advice to anyone listening, but I'm just speaking strictly academically or theoretically. Low-dose immunotherapy could be really helpful. One of the parent therapy of low-dose immunotherapy, which is low-dose allergen therapy, or LDA therapy, it has three core treatment mixtures. There's a food sensitivity mixture, which has about 150 different food types in it, so it's a broad spectrum food sensitivity desensitizer. It has an environmental, or it's called an inhalants mix, so it's got about 36 different environmental allergens like dust or mold or yeast or pet dander, grasses, dust, if I didn't say that one already, and others. And then there's a chemical mix, which has many different chemicals in it. We don't know the exact number, but there are lots, hundreds and hundreds, if not well over 1,000 in it or more. And so the chemical mix from low-dose allergen therapy, in my experience, can be very helpful to help address multiple chemical sensitivities. In my experience, it's really important to address the physiological causes of that as well. So again, like if the SIBO hadn't been fully addressed, that might be an issue, or if there were underlying methylation cycle issues or detox pathway issues that might have led to the SIBO being more likely to manifest, that could impact detox pathways. Because in my experience, folks who are sensitive to chemicals, sometimes it is primarily an allergy or sensitivity to them, and sometimes it's just that they don't detox them well, so they get these they react to them in a negative way because they're just not biochemically processing them very well. But low-dose allergen therapy for chemicals can be very helpful and effective. I do find in patients with multiple chemical sensitivities, or with multiple chemical sensitivities, that they sometimes we do need to start with a fairly low dose of LDA, which is kind of funny to say, is it's low-dose allergen therapy. Sometimes we do have to start extra low dose, just to help them build up a tolerance to it, because sometimes they're very sensitive. In terms of LDA helping with mast cell activation syndrome, if there is a sensitivity to a microbe or a hormone or some other substance that's in the body that a person is reacting to, and it's creating a lot of inflammation, that could be activating their mast cells. And so by addressing that hypersensitivity, that could ultimately reduce the overall release of activation of mast cells in the body. So yes, LDI could be helpful in that case. And then furthermore, sometimes using histamine LDI can be helpful. So that's really a little bit more of like can it help with histamine intolerance? It's kind of a tomato semantics thing there, but histamine LDI could be helpful in mast cell activation syndrome. With salicylate sensitivity, a lot of folks who are sensitive to salicylates just stay away from salicylate. So we don't always have a great opportunity to try out low-dose immunotherapy for salicylates. With that being said, I do have a couple of patients with salicylate sensitivity who have used low-dose immunotherapy for salicylates, and it has been helpful to reduce their reactivity to salicylate. So I don't have a ton of experience with that part of it. Plenty of patients with salicylate sensitivities, but in terms of using low-dose immunotherapy, just haven't had that many patients who have wanted to go there. They're like, you know what, I can avoid those salicylates. It's not that big of a deal, and I'll just live my life without too many salicylates in it. But the low-dose immunotherapy can be helpful. So I hope that this answered the question. If there are follow-ups to this, any follow-up questions to what I've said, feel free to post in the comment section below, or if there's questions about anything else, I'll try to answer those with a subsequent video.